The program got started probably, at least conceptually, from the time that I first joined Jersey Shore University Medical Center about 9 years ago now. Dr. Kairys and myself who's the chair of pediatrics here, had been having discussions about children's mental health. I'm a child psychiatrist by training, and so that's obviously an area that's very close to my heart and that I'm very passionate about. And so we were looking about how we could build up children's mental health services, not only here in Monmouth and Ocean counties, but really looking at a statewide vision for what we could be doing.
Pediatrics in the past was about infectious disease and about immunizations. That's still an issue, but mental health and the effects of trauma on behavior and on future health outcomes is really the dominant epidemic confronting kids.
Unfortunately, child psychiatry is considered one of the most underserved medical specialties in the country. And even here in the Northeast, we still suffer from that shortage.
My mentor in the program at St. Peter's was telling me that it took 8 months, a year, even more, to get patients involved in psychiatric services and get them the services that they needed. And so that's really what the PPC is filling. So our role is to identify patients that are not in an acute crisis, but patients that need extra psychiatric resources, and getting them those resources through the hub, through a referral process, through a very short form that we have to fill out, and then they're being contacted on a timeline of days to weeks as opposed to months.
So the chance to be able to pick up kids earlier, identify them earlier, get them into services earlier, and also to try to get some pediatricians to see this as an area of responsibility for themselves to engage in some basic care management and care provision for these kids. It's really part of what we're trying to do with this program.
And so we wanted to look at a consultative framework where the pediatricians could be supported to provide that care to children and families in their offices where those children and families are comfortable getting care already.
This program is unique, and I think it's definitely the way of the future. Pediatricians see the problems years usually before someone engages in treatment, and they're swamped, they're busy, and there's a lot to cover, and so they very graciously will give out, in the past would give out names to people and say, well, here's some providers. But there are a lot of barriers that hold people back. A patient walking out with their child with a list of providers and then actually making it to starting treatment is a long haul.
I think something we often forget as providers is that it isn't just the patient that we're treating that is affected by this. Mental illness affects an entire range of people, from the person itself to the parents to the siblings to anyone they come in contact with at school. So providing resources to that patient when they're first identified is beneficial to the health of the family and the community in general.
Essentially where we're going is that we are constantly expanding and providing the education, the training, and the support to the pediatricians and their patients.
I think the program has worked even better than we thought it would, really, because there's been such a huge need. So we've connected with over 500 pediatricians who are enrolled in our project. We've serviced well over 140,000 children at this point who've received screening through our program, and about 7,000 kids who've received direct services through the referrals of our hubs as we've grown statewide. I think that the program has just continued to prove itself in terms of being an efficient way to get these mental health services to children throughout the state of New Jersey.
And early identification and linkage to services needed are happening, and as a result, there are better health outcomes. For this, our pediatric champions are being celebrated tonight, and recognition to all of the partners who have been involved in this initiative. The Department of Children and Families, the Department of Health, Medicaid, the Nicholson Foundation, and the team at New Jersey Chapter AAP, who have tirelessly worked together with our champions to spearhead this initiative.
Because this collaborative really provides the framework to not only give access to primary care pediatricians and the kids that they are taking care of, access to this really needed behavioral mental health management. It also is an opportunity for the pediatricians and other practitioners to learn how to manage these kids in their practice. And I think that's just an extraordinary opportunity that's been provided to us by the Psychiatry Collaborative.
From myself and all of the practitioners at the Meridian Hub, I would like to congratulate Dr. Kairys as well as the other leadership in the PPC for making this available for patients in the state of New Jersey, for breaking that barrier, or at least reducing the barrier to getting care in the mental health setting for patients that are not in an acute crisis, intervening before these patients become acutely ill, and improving the health and well-being of all the children in the state of New Jersey.